So basically, Taryn has about like upper thoracic, so T3, T4. One of the segments is extended. You could feel that was a little tender. So we're actually going to induce a little bit of flexion. And the thing is, when I adjust you, like especially in the thoracic spine, I kind of compensate as well with the lateral flexion with the bending. So I always pre-stress you in the way we're going to go. Okay. And then basically what I'm going to get you to do, take a deep breath in and all the way out, and the thrust would be here, and you're pretty easy to adjust. But do you guys use the analogy like packing a snowball?
Yep.
Okay, perfect. So what I do is, this is okay on your shoulder.
Mm-hmm.
Always ask the patient if it's okay. Basically, my two hands are trying to compress the spine together. Of course, we're not trying to crush them, but we are trying to get the compression right over the spot right here. So you can feel the compression's like right there, right?
Mm-hmm.
So big breath in from it, and all the way up, and here's the push. Good. Pressure was all right?
Yep.
Awesome. Now we'll get into the TL junction. This one, I'd say 80-20, 80% more it needs extension, 20% flexion, depending on if it's, do they got lower cross syndrome, what's going on. So big breath right here, and all the way up. Good, awesome. So what I'll get you to do here, turn, face me here on your side, please. So going into the lower back, you have a few different palpations you guys can do. So you guys do the seated scan, of course.
Yeah.
Do you guys ever do where you rock
Yes,
that
sir.
side joint and you basically shear and see how it's moving? This is good to see how tight the joint is, what the range of motion is. We know there's only millimeters of movement in that SI joint, but it helps to get you to where like a lockout needs to be. So here's the right about there. So what I'm going to do, again, switch the arms here. So big thing when you're setting up like any lower back adjustment, you always want the back to be kind of very straight. Like I could hyper rotate you like this and really shear you, but that's uncomfortable, okay? So big thing again, hand here, get your contact, and there's a few variations, right? So you pack the snowball. Variation 1, this is what, have you guys been taught by Dr. Winchester?
Winchester, no.
Okay, so he's a tall, lanky guy.
Yeah.
I'm not tall or lanky, but I do like to do that his style. So the one variation is you basically, instead of getting right over here and you know the drop, snowball here, here, and here. Again, you get that right arm nice tight so you don't wreck your shoulder. And the thrust is up into the other end of the table. Variation 2, this is how I started, and I used to teach myself with like an exercise ball, which is brutal. Like I used to be the creepy guy in the gym doing weird exercises. But you basically come here, you can bring the leg behind you up in the air, and from here to here, and it's that straight drop, okay? I find for taller people, the lunging's best. I also find for gauging pressure it's the best. And on top of it, you don't crush your chest, okay? So what you'll feel, so take a deep breath in for me, and all the way up, and here's the thrust. Good. So I combine the two, right? So I I do the drop, but I also lunge, and it also helps with really big people because I take care of like some 300-pound guys, and it helps. Okay? So this one I'll do a little bit of a different adjustment since I want to induce more extension into it here. So what I'm going to do is, do you guys ever do, okay,
Yeah.
perfect. So it's been a while since I've done this on somebody, so. So basically what I'm going to do, we're going to like bring it in here. Again, arms tight, and the thrust is up to the opposite corner, or if you want to do the drop, straight down, okay? So big breath here, all the way up. Good. Awesome. Pressure is okay?